Live from Studio 5 in New York City, this is the News at 6.
Well, it's Monday. Hi, everybody. I'm Ernie Anastas, and we thank you for joining us again today. And welcome to another great week of special shows designed with you in mind. All right, we go online for shopping, right? Banking and much more. So what about our medical needs? Tonight, we're taking you into the doctor's office of the future. We're going to see how technology isn't just being used to cure you. It's now being used to diagnose you, and without you leaving your home. Linda Schmidt has a fabulous look inside at today's digital healthcare.
Your routine doctor visit could end up turning into an e-visit, seeing your doctor online.
It tells us that the industry is beginning to respond to the expectations that the consumer has.
PricewaterhouseCoopers provides advisory services to the healthcare industry. It conducted a study and it found that half of the doctors it spoke to believe that e-visits could replace more than 10% of in-office patient appointments. Plus, about 75% of doctors say they would prescribe an app to patients to help them manage chronic diseases such as diabetes.
In finance, we've got a whole nother level of digital banking in the retail space. You know, the consumer's expectations are, I want to get the right product at the right time. They want to have that experience in healthcare.
Dr. Ezriel Kornel is a neurosurgeon with New York Presbyterian Weill Cornell. He says e-visits would not replace initial face-to-face appointments, but would be useful for follow-up visits for a variety of health issues.
For instance, for urinary tract infections, for sinusitis, for pink eye.
Dr. Kornel also supports prescribing apps to patients to help them manage some of their chronic health issues.
With a diabetic who checks their blood sugar regularly anyway, the app maintains a record of the blood sugars and can adjust the insulin dosage needed based on that individual's variations in their blood sugar.
At New York Presbyterian Hospital, Dr. Peter Fleischut says digital technology is making doctor-patient relationships more efficient. The hospital has incorporated texting in situations such as surgery.
They will get real-time alerts as to the status of their loved ones. Specifically, when the procedure begins for that patient, they'll get a text message. When the patient enters the OR, they'll get a message. And when they go to the recovery room, they'll also get a text message.
The hospital also provides tablets to patients so they can monitor their treatment from their hospital bed.
It now gives them the ability to see all their care team members, for them to be able to communicate with their care team members, to see their home and hospital medications and their lab and radiology tests, and even access things like the internet.
New York Presbyterian and other hospitals have already converted to electronic health records. However, a complaint among some health providers is that there can be a problem transferring a patient's records from one hospital to another because the hospital's technology is not compatible. In an emergency, that could create a dangerous gap in care.
That is a problem right now. And I work at several different hospitals, and they each have a different system. In the long run, there will be more pros than cons. It's just that those systems need to be refined.
Linda Schmidt, Fox 5 News.